Hi guys, my name is Ralph Kishanalin and I am from BSN3B, and today I'll be doing my return demonstration about chest physiotherapy. So, chest physiotherapy is a treatment designed to improve respiratory efficiency, promote expansion of the lungs, strengthen respiratory muscles, and eliminate secretions from the respiratory system. And chest physiotherapy has three methods. First, we have postural drainage, is the use of specific positions to drain secretions by gravity from various lung segments. The second one is percussion. It is the use of technique of cupped hands striking forcefully the chest wall over the congested area while the patient inhales and holds his breath. And the last one is vibration. Is used after percussion over the same area but when only the patient exhales. So the purpose of chest physiotherapy to help the patient breathe more freely and to get more oxygen in the body. Second is to remove secretions that have accumulated in patients who have chronic lung diseases. And the third one is to prevent the accumulation of secretions in patients who are unconscious with a mechanical ventilator. Uses of chest physiotherapy assist in coughing, reeducate breathing muscles, and improve ventilation of the lungs. So the indication of chest physiotherapy, it is indicated to patients whom cough is insufficient to clear, that is thick, tenacious, or localized secretion. So examples of that is cystic fibrosis, bronchiectasis, atelectasis, lung abscess, and pneumonia. So chest physiotherapy should not be performed on people who have bleeding from the lungs, head and neck injury, fractured ribs, collapsed lungs, damaged chest wall, tuberculosis, acute asthma, recent heart attack, pulmonary embolism, lung abscess, active hemorrhages, some spine injury or surgery, open wounds, and burns. So chest physiotherapy may complicate into the following complications. We have hypoxemia, increased intracranial pressure, acute hypotension, pulmonary hemorrhage, pain, injury to the muscles, vomiting and aspirations, bronchospasm, dysrhythmias, and excessive lung volume. So during the preliminary assessment, we need to check the following. First, we need to check the doctor's order, the client's chart and cardex. We also need to check the equipments required, the suction apparatus, the mechanical percussor. We also need to check about the cardiac monitoring, the pulse oximeter, the chest radiograph, and your emergency airways. So here are the materials needed. We have 4 pillows with sheets, so 1, 2, 3, and 4. We also have our bed sheets, our top sheet and our bottom sheet, our stethoscope, and our sputum container. So that's the materials needed. So make the patient comfortable before the procedure starts and as comfortable as possible as he assumes each position, and explain the procedure to the patient. This is to make it easier for the secretions to drain properly, and it will promote patient participation and anxiety reduction. But before doing that, you need to sanitize your hand or do hand hygiene. This is to prevent the spread of microorganisms. Good morning, sir. My name is Ralph Kishanalin and I am your nurse for today. May I ask for your full name and your date of birth?
Oliver Kim Paulsen, September 3, 2008.
Okay, sir. Let me check your wristband, sir. Okay, sir. So the doctor has ordered for chest physiotherapy. It is a treatment procedure that is designed to improve respiratory efficiency. It will promote expansion of the lungs, and it will strengthen your respiratory muscles and remove secretions from the respiratory tract. Is that okay, sir?
Okay.
Next is you need to use a stethoscope to determine the areas for drainage, and you need to make sure that the stethoscope is disinfected before you use them. Okay, sir? Mamina ko sa imong liyo, sir, ha? Kaya ito pamilang imong lung sound, sir. Clear ba, sir?
Okay.
Ginawa, inhale. Inhale. Sir. Thank you, sir. So, upper lobes are generally drained by upright position, and lower and middle lobes are drained by head down position. So have the patient assume the left prone and the left oblique simultaneously. So let the patient assume right prone and right oblique simultaneously. So encourage the patient to cough after he has spent the time in each position. That is usually around 20 to 30 minutes, and be sure to prepare your sputum container so that he can cough on. Sir? Ubo lang ta, sir, ha? Nyari lang na to, ibutang na tong ubo niya, sir. Kuniti, sir. Okay, sir. So you should encourage diaphragmatic breathing during the postural drainage exercises. This is to aid in the drainage of mucus, and it will also encourage the expansion of the lungs. And the next procedure is percussion. It is a technique of using cup hands to strike forcefully over the chest wall, over the congested area, while the patient inhales and holds his breath. The first thing you have to do is you need to instruct the patient to use diaphragmatic breathing. Sir, pag-diaphragmatic breathing to, sir, ha? So, inhale na to, sir. Hinay, radin mo. Exhale sa tahinay. So, start to, sir. Inhale, hinay. Exhale, hinay. Inhale, hinay. Exhale, hinay. So, okay, sir. Thank you, sir. Position the patient in prescribed postural drainage position, and the spine should be straight so that it can promote rib cage expansion. So, sir, position ng tagtarong, sir, ha? So, straight lang na to itong buko-buko, sir, para ang atong lang, sir, kaya ang atong rib cage, kaya mo expand taglarong. So, okay, sir. Thank you, sir. Percuss or clap with cup hands over the chest wall for 1 to 2 minutes from the lower ribs to shoulders in the back. So, okay, sir, mag-start na to, sir. So, inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, sir. Thank you, sir. Next is from the lower ribs to top of chest in front. So, okay, sir. Start na ta, sir. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, sir. Thank you, sir. So, avoid clapping over the spine, liver, kidneys, spleen, breast, scapula, clavicle, or sternum to avoid injury to the region. And the next method is vibration. It is used after percussion over the same area, but only when the patient exhales. So you need to instruct the patient to inhale slowly and deeply. So we need to vibrate the chest wall as the patient exhales slowly through pursed lips. This is to move secretions into the larger airways. Then we need to place one hand in the top of the other over the affected area, or place one hand on each side of the rib cage. This will help facilitate in vibration and effective drainage of secretions, so just like this. Then after that, we need to tense our muscles of our hands while applying moderate pressure and vibrate hands and arms. This is to provide proper breathing and to proper expectorate the secretions. So just like this. Inhale, sir. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. So, you need to relieve the pressure on the thorax as the patient inhales, and encourage the patient to cough using his abdominal muscles after 3 to 4 vibrations. This is to expectorate the secretions. Then after that, you need to allow the patients to rest for several minutes. That is to ensure that the patient is at ease. And last, we need to listen with the stethoscope for changes in breath sound. This is to assess whether there are any fluids or any mucus. Inhale, exhale. Inhale, exhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, sir. Thank you, sir.